Aging Well Senior Health Advisories deliver important information to educate and support seniors about the importance of preventive health, making and keeping doctor appointments, prescription medicines, and good nutrition to prevent obesity and reduce risk of disease. Preventive health and wellness, an ounce of prevention.
Regular checkups are important for a number of reasons. The first is to make sure that any health concerns you may have, you're able to share with your provider, and nothing is too simple or silly. It's important that any concern you have, you ask and talk with your healthcare provider about. It's also a time where prevention information can be shared. If you're smoking, stop smoking. Are you wearing your seat belts? Are you safe at home? Also to find and recommend any prevention examinations that might be necessary. Mammogram, colon cancer screening, pap smears, if that still makes sense for a woman. So it's an important time both to get your concerns addressed and answered, important health education messages to you, and then to make sure that all the appropriate screening for cancer and chronic illness is done. And certainly if you have chronic illness, that's managed and a plan for that management is put into place.
I try to keep my physical self in good working order, let's say, and I figure if I don't go see about what needs to be done, then it's my own fault.
Medical professionals encourage education and wellness to help people live happy and productive lives. One way to do that is to get eyes, bones, and teeth checked regularly as part of overall health.
It's important to get your eyes checked for a variety of reasons. So one, just your vision per se. It's gonna, if you see better, you're not going to be as much at risk for falls, so that's important. There's also glaucoma risk, one of the major causes of blindness in the United States. So in order to get that checked, you probably need to see your eye doctor and get a pressure check, probably once a year. In terms of teeth, that's interesting. You should get good dental care because the dental cavities that you have, it's not just with chewing and everything, but the inflammation from that actually seems to increase your risk for heart disease and other things. So it's important to get good dental care as well.
For oral health, it's important to get checked for periodontal disease, and that's actually linked to heart disease if it's untreated. And then for bones, both men and women can have osteoporosis, which you wouldn't necessarily know. And if that's detected and treated, you can prevent things like bone fractures.
Eyesight deteriorates over time. People who wear glasses or contacts should get an eye exam every 2 to 4 years. Glaucoma is a condition that can appear quickly. High-risk individuals include those who are nearsighted, have diabetes, are African American, or have a family history of glaucoma.
In order to detect glaucoma when it's early and treatable, you need to have the pressure checked, and so you need regular eye exams.
Eyesight is real important. As people get older and their vision isn't as good, if they don't take care of their eyesight, they can have issues with glaucoma. We like to stay on top of that. That's important. But also they need to have good vision to make sure they protect them from falling and things like that. So we like to get their eyes checked every so often. It's good to get in. I encourage, most plans will cover every couple years, but ideally if you can get them in every year, it'd be perfect.
People often stop seeing a dentist. Not only is this bad from a dental health and hygiene point of view, it can also lead to other health problems.
One of the most important aspects of dental hygiene is nutrition. When an older adult can't eat right or drink right, it will impact their health in a very dramatic fashion. Some people even end up in a hospital from lack of proper hydration and nutrition.
For women over 50, mammograms are recommended every 1 or 2 years. Annual MRIs are recommended for those at high risk. Women with family histories of either breast or ovarian cancer should get checked for mutations linked to both diseases.
Mammograms are important because the risk of breast cancer is so high. 1 out of 9 women in their lifetime will develop breast cancer. 1 out of 25 women will die from breast cancer. It's very common. So it's important to get a mammogram. It will save lives. About 80% of breast cancers now caught are curable.
Mammogram detects breast cancer early. All women over age of 50 should have a mammogram done on an annual basis or biannual basis. This is something that they can arrange with their physician's office, and simple ounce of prevention can go a long way.
DXA is the best test for osteoporosis. It measures bone density at the spine, hip, or forearm. All women should be checked at 65 and every 2 years thereafter.
Any woman over age of 65 should have a bone density scan completed to screen for osteoporosis. By daily exercise, such as walking, jogging, along with vitamin D and calcium intake, we can prevent osteoporosis and hip fracture.
PSA screening measures blood levels of prostate-specific antigen. Prostate cancer is slow-growing. Screening can result in false positives and unnecessary biopsies, but the process is designed to keep you healthy. It's also important to screen for colon cancer.
Colon cancer is common. The risk of colon cancer over one's lifetime is about 1 in 20, and colon cancer is the second leading cause of cancer death in the United States. Colon cancer usually starts as a small bump or polyp, and over years grows and becomes colon cancer. That transformation from benign colon polyp to colon cancer takes many years. When we look periodically with the camera and remove the polyps, we can significantly reduce one's risk of colon cancer. We can also detect early stage cancers, which are easier to treat with just surgery or resection alone.
Well, a lot of men feel like if it's not broken, don't fix it. They feel well, so they don't think they need to go to the doctor. But a lot of diseases like high blood pressure, high cholesterol, and diabetes are often without symptoms, so you wouldn't know you have them. If you're going for regular routine health maintenance exams, you can detect these things early when they're treatable and prevent problems. So I tell men, if you spend a few dollars in time on your car, you should at least do that for your body.
The Aging Well Senior Health Advisory is produced by Seattle Community College's television in cooperation with Public Health, Seattle and King County, Snohomish Health District, Essence Healthcare and its participating hospitals and medical centers in Washington, the Polyclinic and the Everett Clinic.